to pick when your sugars are low. Watakwambia wewe sugar yako iko chini. They're going to pick when you're high pressure, when you have high pressure and all that. So that right now we're doing it from the levels of webinars, health talks and all that. Like whatever we're doing right now is one of it, just to create awareness. But I also feel like it's also important that in the programs that we have a segment that we bring in the caregivers, people around the patient, to make them understand the conditions better and how they can help the patient take care of themselves better. Yeah.
We've also had cases where men have been reported to have, poor health-seeking behavior, especially when it comes to HIV, going to, just for testing and whatnot. How about chronic illnesses? Are they coming more for these checkups? And let's look at it from the gender perspective, between men and women. How is the health-seeking behavior like when it comes to chronic diseases?
Of course, when it comes to gender, even in the hospital statistics, you find more women and children seek for services unlike men. And most men, for them, even when you're doing the awareness and the annual checkup, you pick some of these cases, but it takes a long time to be able to convince a man to start taking care of their pressure, sugars, or any other thing that you're going to pick, maybe high fats and all that. There's still a lot in terms of change in their perspective of healthcare. And I believe when you see a man in the hospital, just know it's very serious. Like it's something that has really affected their day-to-day lives. Men can live with the symptoms forever. So long as they're not affecting their work, they're able to wake up and move on with their day, they can still go on until it's very, very debilitating. And like for women, even a simple headache, even a simple rash, they are already in the hospital. So I think it's more of awareness and showing the patient the importance of why should I seek services why should I even see my doctor even if I'm not sick? Because I think most people visit their doctors only when they're sick. And as we insist, as we're doing the change of healthcare seeking behaviors, we're looking at having a family doctor. This is something that has been practiced in the West, and it's very effective because your family doctor is not only your doctor, that is your friend. You talk to them about anything that is happening to you, and they're able to pick some of these issues as early as they happen, and they're also easy to convince the patient that now it's time for you to start taking steps towards it. So it needs awareness, even in the gender, in the gender area. There's a lot of awareness that is needed. Yeah.
But when we talk about sometimes these men, they come when it's already too late. And we said at the beginning that 27% of deaths in Kenya are from these NSDs. And of course, a lot of hospital beds also, a lot of people are there because of these chronic illnesses. So do you see the rise in men because, they wait for long before coming to seek for these health interventions, or are women the lowest number in these hospitals?
Of course, also because of when you look at even the population, women and children are more. So even in this health-seeking behaviors, women and children will still be more because population-wise we are more. But for men, the best thing with men, when they put their mind to it, they will do it. When they get it, that's why I'm talking about awareness. Yes, found out that your sugars are high, your pressure is high, or you have early signs and symptoms of thyroid issues. How do I deliver the news to you? Most of the time, I know that the doctors end up scaring the patient because like, if you don't take care of this, you're going to come back with kidney issues, you're going to come back with heart issues. But I think that awareness and just using simple language to explain to the patient. Most of the time when I'm talking to my patients, even about simple issues, I just tell them in simple language for them to understand, how is this going to affect me? How is this going to cause the complication? Because ukiniambia niko na pressure, then uniambia kidneys, I'm like, they're not related. How is that going to come about? But when you explain to them in simple language, avoiding the medical jargon, for them to understand what is going to happen in the future, then we can see a shift. I see a shift, and they will look for you. And the issue with the healthcare system is you find, today I've come to the hospital, I've found Dr. So-and-so. Tomorrow I come, I find another doctor. because of the shifts and all that. Most patients don't like that because I don't want to come and start afresh and start explaining a story that I gave another doctor the other time. So I believe that's why I talked about the primary doctor will help create a shift in that, because treatment does not start with medication. Treatment starts with trust and rapport. You understand each other, I understand you as a patient, you understand me as a doctor, and that's where treatment comes. And it's so easy to give instructions and patient to heed instruction if they trust you and if you've created a rapport with them. And that doesn't come when you're changing practitioners from doctor so to so to so to so. It doesn't create that trust, because at the end of the day, I talk about how we deliver information. We can be told one sentence right now, and you'll be told to deliver it to 5 people. The way you deliver it is so differently. The same case with healthcare. The way you deliver the message is different from the other doctor, is different from the other doctor. And that disparity is what patients are looking for. Just a disparity in a statement. They're like, madaktari hawaelewi. And then they stop looking for healthcare. They feel like there's no connection or things are not adding up. So that is in terms of primary health care doctors, that will help change the shift in terms of care. Yeah.
How do you handle a patient who has, say, chronic illnesses, not one, but say multiple ones, say diabetes is there, heart disease is there, let's talk even about kidney failure is also there. How do you handle that?
So that is a patient that needs multi-department management. You can't handle, you find that you can't handle that patient alone. So the way the program is set, even for Myer Hospital, is ensuring that you have that primary care doctor, that is a GP. A GP is your friend who will work with you. So they know Monica has diabetes, she has a kidney, she has kidney failure, she's on dialysis, she needs dietary advice, she needs psychosocial support, and also she needs physical support. So it's me as your primary care doctor. That's why I was saying we need a shift in the healthcare ecosystem, that me as your primary doctor ensure that you've met all the requirements for your follow-up. So if you need to see a diabetologist, I'm the one to talk to you. You need to see a diabetologist. You need to see your psychologist. You need to see your nutritionist. You need to see all that. So that can be managed if you have one doctor that is able to bring cohesion between all the departments.